blood transfusions are needed when there is over 40% amount of blood loss. As John walks to his mother's house, a speeding red car rammed into him, leaving him pinned to a tree.
What?
Luckily, he is still alive, but has lost a lot of blood.
I'm alive?
Without enough blood, the body does not receive a sufficient amount of oxygen to circulate the cells. When a blood transfusion is received, the red blood cells are replaced along with their hemoglobin, allowing it to once again circulate through the body. At the site of an injury, all the platelets and red blood cells begin to stick together, creating a net closing the wound.
Really? How?
The way this works is that when the platelets are in the blood vessels and there is a cut, cytokines from the damaged cells are released. The platelets are then activated, become sticky, and start clotting. Clotting factors then come into play as they activate fibrin and thrombin. Net is then created at the site of the wound. Collagen proteins finish the clotting process, creating a scab. John has been doing well and has recovered from his wound. He feels a sudden pain on his chest.
I do?
Says John. John is rushed to the hospital. Doctors soon determine he has a heart problem and needs surgery immediately. During surgery, there is a large amount of blood loss in which needs to be replaced. Following the surgery, doctors know that John needs a blood transfusion. About 1/3 of all heart surgery patients need a transfusion. After recovering from his heart problem, his stomach begins to rumble after drinking a cup of orange juice. Turns out, he has a peptic ulcer.
You're kidding me!
The peptic ulcer was formed because he was taking a lot of aspirin after the accident due to all the pain. A peptic ulcer is a sore on the lining of the stomach or duodenum, which is in the beginning of the small intestines. When acid or the ulcer breaks a blood vessel, causing 40% blood loss, a blood transfusion is necessary.
Man!
Other illnesses that require blood transfusions include a severe infection or liver disease that stops your body from properly making blood or some parts of blood. An illness that causes anemia, such as kidney disease or cancer, medicines or radiation used to treat a medical condition also can cause anemia.